I ran a shelter and transitional housing for severely and persistently ill, chemically dependent veterans in the cities. I really wish people could see past the homelessness in people and see value in everybody, whether or not they're mentally ill talking on the corner to themselves or whether they're in a drunken state. They have value. People have value. They have a lot of things that they could be contributing. And it's our job as a community to bring that out in people, not keep pushing them down, but bring out their value and their gifts.
When I think of all of the people I've worked with in the past 18 years in transitional housing, the human spirit has really impressed me. With all the people I've worked with, to see them really grab a hold of their lives, to humble themselves, in many cases, to accept the services that they need and work with those services. None of us are self-sufficient. None of us could do it by ourselves. But for our residents, it has boiled down to some of the real critical things. Because there's not a support system, they end up homeless.
Well, I do a little presentation at the school sometimes about who's homeless, and I talk to little first graders and second graders and explain to them, and I tell a story about someone who was homeless and their experience, and then when I'm done, I explain to them that it was me, that I have experienced this in my life, and that has been part of my history in my life, and they're very shocked. Anybody can be homeless.
This year, we currently have about 121 students in our district that are identified as homeless. Although there are families with younger kids that are having problems, we have a lot of unaccompanied youth in our district that are 16, 17, 18, and for whatever reason, they've been kicked out or they can't live with their parents.
I'm a homeless outreach social worker. Homelessness seems to occur across all levels of society. I've had clients tell me of having earned great amounts of money working in upscale careers with families and children in beautiful homes, only to have things unravel with them. Other times I've seen clients with very low IQs, extremely abusive backgrounds, and lack of any support systems who report having struggled in poverty all their lives.
The most important thing that I learned in being involved in these different programs, and that label that we talk about and gets thrown around so often, just dissolved, because these weren't homeless people or street people. These were friends of mine. The other day I was in a grocery store and the fellow bagging groceries came up and looked at me and said, "Carolyn," and I recognized this individual from a couple of years ago, and he was so excited. He said, "Look, I've got this job, I work here, things are going well, I have my own place," and that was his dream.
I still remember one of the little girls who, she wasn't so little, she was an 8th grader. Her family had just come out of Anna Marie's, and they hadn't had an apartment to live in for a number of months, so they had been living with another family. They had no furniture, they had no dishes, they had a couple of blankets that they were sleeping on the floor of the apartment with. To even get on the bus some days, these kids had to go through horrendous things. Might have been getting their 3 brothers and sisters up with no food for breakfast, but just getting them moving and getting them on the bus. No clean clothes. That happens.
And a lot of kids don't want other people to know. And so it's really hard to have friendships outside of school when you don't want them to know what your home life is like and you don't want them to know about your living situation.
If you've never been homeless, it's very difficult to understand because you just can't get it. I think some of it is people have a strong, stable support system around them, maybe generations of stability financially, socially, and in all different other areas, and they cannot comprehend how somebody could just have an event happen and end up homeless, and why can't you just get it together? You know, what's the deal? And It just doesn't work like that when all those components are not in place in somebody's life.
Until I started this position, I did not know how difficult and time-consuming it really is to be homeless. Finding food and keeping close to shelter consume most of a person's day. Suffering from poor living conditions, alcohol and drug abuse, and deteriorating mental and physical health is not always easy to see.
I have great respect for the challenges of the people I work with. I often wonder, you know, would I do as well? Would any of us do as well if, under those circumstances? And I guess, you know, we don't know, and we don't have to know that, but they do. They have to know that.
There's situational homelessness where people just living your life paycheck to paycheck, and you go into work one day and the boss says, you know what, the plant's closing down, and as a matter of fact, it's closing tomorrow. This is your last day, here's your last paycheck. All of a sudden, boom, there's a crisis. We don't have a home, we have no place to live, or we don't have the money, now we can't pay our rent, can't get a new job. It's situational. It's like, whew, minding my own business, and this all came about. There's situational homelessness, and then there's people that have maybe chronic issues, mental health issues, and things like that, that maybe have some barriers and different things going on that would be a longer period of time, maybe up to a couple of years that they've been struggling with this, and they need maybe to go to treatment or some of those things to help get their life back on track. Then the third component would be people that really have had long-term, 3 to 5 years, they've been struggling with being on the street, and most of the time, a lot of times there's some mental health issues in there, chemical dependency in that population that is untreated, and you get to a point of hopelessness in your life where you just don't feel like you can get out of that hole.
The most significant common denominator of homelessness, as documented by the Wilder Research Corporation, is people who have had a difficult start in life. And what that really implies is that they haven't had that support system, and they don't have that support system. I have a resident right now who, and this is fairly frequent and kind of sad, who literally has no family. Her parents are both dead. She's a single mother who has really no one in this world that she could have moved in with. She had nowhere to go.
The fundamental problem is the gap between people's income and the cost of housing, whether it's apartments for lower income people or houses for somewhat higher income people. The usual definition of affordable housing is not spending more than 30% of your income on your housing, whether you're renting or owning a home. And there's lots and lots of folks in our community who spend more than 30%, some that spend more than 50% of their income, which is a classic sign of not enough affordable housing.
The people that we run into a lot, our families are working families, but they're stuck. What these families are running into is they're spending well over 2/3 of their monthly income on rent. Like if you get a kid that gets sick, well, that's the rest of your money right there.
The best situation really involves a partnership. The biggest resource that I need to, as a professional, tap into every day is the energy, all the skills of our residents, of the people who are participating in the program. I encourage them to have a real vision of what their effort today is ultimately going to get them. But they can't do that without really entering into those key partnerships and relationships with various services, with individuals, some kind of connection with the community.
If someone comes to us in need of shelter, we give them their basic needs, provide basic needs, clothing, shelter, and food. And then at that point, we work with them on the other needs that need to be met besides the basic needs. Help with housing, help with employment. We have a case manager that works with every client, and she meets with them and tries to assess their needs and uses a strength-based approach and trying to find their strengths and how they can work, how they can help themselves to get up again. Each shelter is different. The shelters range from anywhere from 30 to 60. We're trying to get ours to 60 days.
By definition, transitional housing is temporary housing, ranging in time from 2 months to as long as 2 years. People have an agenda. We work with them to develop an agenda, a self-sufficiency plan, we call it, although we have to acknowledge that none of us are self-sufficient, that all of us depend on various community resources, and really the terminology we should be using is really a healthy interdependence. The majority of people who do move into independent housing without services, I think it's important also to say that for some people that doesn't work. For some people, for the foreseeable future, they are going to need some level of support that is provided for them, and that's kind of a supportive housing model.
And students do qualify for title services automatically if they're homeless, and also we have a teacher who goes throughout our district and works individually or in small groups with our students to help them academically stay at the level that their peers are at.
In our housing program, in the SHI program, what we do is we help them establish their goals. Because usually kids come to us and they need more than housing. They need some independent living skills, they need some credit restoration maybe, they might need they might need some other financial assistance, such as maybe they had a huge car repair, things like that. So what we do is we sit down with them and we create what we call an independent living plan. Go over goals with them and then track their progress with them. And we just help them get out on their own.
Project HEAL is a big relationship between Mid-Minnesota Family Practice, the church, at the hospital. Outreach clinics then are staffed, or the team leads are parish nurses who go out into their congregations and they recruit doctors and nurses and others, and they come in, they put together a little team and go out to these community service sites and provide health screening services.
I'm an advocate, and I'm a broker of services, and I'm a go-between between institutions and individuals, so that a lot of the barriers that they face when they go out to try to reach out for help are either less or removed entirely, partially through our programming, whether that is a residential treatment program or one of our psychiatric programs, or even the independent living skills program. We really are able to help veterans find self-respect, dignity, a way forward, trust in themselves, basic trust in other people, and a desire to not go back to where I was before. That's our job, is to help homeless veterans to not go back.
We have a program that has two things. One is a reentry program where we find them all the things that they need, such as their housing, jobs and education and other type of services. The other program that we have is a mentorship program where we provide a volunteer mentor from the community, like I was for 20 years to these people, and we mentor them. We become their friends.
Our goal is for every one of our fellows to see them connected up in at least 3 different organizations that are going to be supportive of their recovery and their reentry.
I mentioned I was on the city council. We needed a place for those people to sleep, to spend the night when our shelters were full. So we talked with, then I as a city person and the mayors and others talked to our inspection people and talked about the program. We also came with a great number from the faith community who said, we'll help. If you can do this, we'll help. So amazingly, the city got on board and the health inspector helped us do things. And the fire inspectors made sure we were safe, made sure we had signs up and exits and all the things that we needed. And it was huge. The other thing that came out of that was the fact that as we brought people into these churches and our congregants volunteered to spend the night on shifts and prepare a meal and have snacks ready, they were just awed by the people that came to stay.
In the city of St. Cloud, in the last 5 years, there has been actually, it's over 2,000 individuals who have actually experienced homelessness experience by helping or being an overnight person or transporting or doing something to give them an eye-opener, to wake up and say, wow.
Central Minnesota Habitat for Humanity is striving to do 10 homes a year by 2010. The house is primarily built by volunteers. Our Habitat partner families, they are committed to partnering with us to build their home. But some of our partner families, they do have disabilities which prevent them from actually being on the job site. So we find other things for them to do around the office and whatnot. That's that first step there, is partnering with us and helping us build the home for them. Once they are in the home, they have a mortgage, and it is a no-interest mortgage, which is generally a 20-year mortgage. That is based upon their income.
Once we decided that affordable housing was something we wanted to work on together, people in GRIP did interviews with various community members and leaders in the community, elected officials, builders, all trying to understand the whole topic.
Well, we encouraged and worked with one of the St. Cloud City Council members to call a meeting of all 5 city councils. And we held that at the Civic Center. About 200 people came. The politicians were amazed that this many people come out, not to complain, but to have something good happen. Out of that came lots of debate, but eventually a proposal for the Joint Powers Agreement. In the briefest terms, it is that each city committed itself to ensuring that 15% of all new construction, both houses and apartments, would be affordable.
2007, the cities that had been working together as part of the Joint Powers Agreement decided to discontinue working together, but continue to be committed to looking at affordable housing. The new housing committee was formed under the Joint Planning District Board to try to focus on timely issues in housing that will allow for communication between the elected officials and other city officials and other aspects of the housing industry and the communities.
The continuum of care covers 14 counties in the state of Minnesota, and what it is it's a committee made up of local HRAs, Housing and Redevelopment Authorities. We have people from like Minnesota Housing Finance Agency, from the Department of Human Services. We have people that run their own, like Salvation Army, Catholic Charities, people that run their own programs from the 14 counties. The local planning of the continuum of care is so important because typically what happens is the funding for homelessness is thought of as a metro problem. So this local planning gives us a voice as that we would not have otherwise.
I am the task force chairperson of the Public Education Task Force for GRIP. We have been to the Capitol, we have met with our legislators, we have testified before committees at the legislature, we have been involved in rallies at the legislature and in prayer vigils at the legislature. We've been at it since 2003. We have Republicans as well as Democrats who understand the issue.
We have an opportunity to help people to find hope again and get them to understand that there is hope, and they have a lot of strength. They have more strength than most of the people that have never been through this stuff. Hope is it's a belief we have inside that something can be better, something can change, or that I have value. You know, I'm a human being, I have value. If you hope in something, you have that feeling inside of you that, yes, maybe I can do this. Maybe there is possibility of change. Maybe somebody does care about me. When a person has hope, their whole attitude changes, their whole being changes, their whole, what they say, what they speak, what they do. So it starts with hope, and then their actions can follow.
There's a real quick story about a Middle Ages, scene. Imagine this of a building going up, and two bricklayers working kind of side by side, and a passerby stops and asks the first person, "What are you doing?" "Well, I'm just laying bricks." And he wasn't doing as good a job as the next guy down the line, and the guy said, "Well, what are you doing?" And the guy looked at him and he said, "I'm building a cathedral." And I think we could substitute the word community there. And I think as we invest in people, that sense that we are all here building that community is very important. And we may not know we may not see the outcomes. Some of these Middle Ages cathedrals took generations to build. But the people who knew that they were building that cathedral, I think, or building community in this case, that sense really is empowering to all of us. And I think it's always worth considering.